Hello and welcome. Have you seen this? It is something that we use so often today. It's a part and parcel of our livelihood, our recreation, and this is why we should know more about this electronic good. Why? Screen addiction is affecting a lot of people. First thing that we see in students, in children, is irritability, their sitting posture, how they sit. Are they sitting right? Are they walking correctly? Are they aware of their surroundings? Or just engrossed with this instrument? Will this help in them getting better marks? Where you notice that the children's grades are falling, it is for us to take note of the other changes that you may notice in the individual. It could be social interaction becoming lesser. It could also be that they do not want to communicate together with the family. It could also be a sign of not working together in circle times. So there are certain activities that we must bring into, and this could be circle time as a family. It could be games on certain days. It could also be restricted mobile areas, eating zones, even while and have restricted timings for certain things, because screen addiction is not just about screen addiction, it is about radiation too, because mobiles emit radiation to which the Wi-Fi gets connected. And if we are not aware of it being a silent killer, and we get it into our bedrooms, into very close to our beds, we are taking in a risk. It poses a health risk. It poses a health risk in a sense that we may not be aware of it, but it's a silent killer. We see the increase in cases in the hospitals due to radiation. We also see the increase in children going into the eye doctor for glasses. We also see how it is affecting their hearing and communication. It's not about just hearing, even their listening skills are becoming weaker. And to avoid all that, we need to understand what screen addiction is. It is to start awareness regarding to have a mobile stand when you're using the mobile. You also need to know when there are too many metallic surfaces. For example, a vehicle, you're not supposed to use the mobile because radiation can be more powerful in those areas. It doesn't reflect, but it is contained more in those areas. You also should know that when the mobile is charging, we are not supposed to use it. And then also, when the mobile charge goes down below a certain percentage, it is not supposed to be used. Charge the mobile well, but do not use it when it goes down 10, 5 and all that, because it's very risky. You have to see that screen addiction is not just about using the mobile. It is to create an awareness in the family as to how it can be used. You can use the mobile better. At the same time, bringing in restriction and boundaries to this mobile. Draw a boundary about not allowing to be used during eating time, not allowing to be used when you're doing your studies. It is to be kept as far as possible. When we mean studies, we mean have it as a detox time. That's way to inculcate discipline, habit formation into the kids, because most of their postures sometimes is posing not only concern for the circle of concern, but it also means the posture is not correct. That also poses concern, which comes in the circle of control. How do you control this if they're not able to have the right posture? If they're not, you're keeping it too close to their eyes, it affects their eyes too. So all these restrictions we have to self-impose, and we should have family time, communication time. Even it would be singing, getting back to the old way of competition, singing competitions, speaking, public speaking, and all that as a family exercise. Even games being played together, outdoors and indoors. This can bring about a lot of change in children, and they also can learn there are other things which they can exploit and enjoy. So screen addiction is a concern. It is also a matter of, it is a circle of concern, and you need a circle of control. You also need a circle of how one can intervene during this period of screen addiction. Thank you.